So after I graduated my master's in 2021, and then I applied to medical school. I go to Rocky Vista School of Osteopathic Medicine in Denver, Colorado, and I graduate next month. So I matched emergency medicine at Henry Ford in Providence, in Southfield, Michigan. So as a DO student or as like a US student, our path is a little different. So for us, our first 2 years are like the book years or like didactics, and then your third year you do six core rotations, and then you during your fourth year, after you apply or during when you apply, that's when you do like your audition rotations or the rotations where you really want to stand out, and those are the rotations that are specifically tailored to the specialty that you want to go into. So I think one piece of advice I have is, so when you're applying to these audition rotations, I know a lot of schools you use the websites like VSLO or Clinical Nexus. So I use those to apply to the hospitals that I wanted to match at. But one thing that even worked even better was just looking up like the medical school coordinator's email of the hospital that I wanted to go into and just emailing them directly. And a lot of times I would get a response quicker, and I would start earlier than if I would have done it through like the websites that the school gives you access to. And so for me also, so typically as like a US grad, you take your step two between the years third and fourth year. So a lot of people take it in the summer, so like around June and July. And then the application or the ERAS application opens June and then ends in September. So I ended up taking my step two I ended it in July. And so then I started rotations July and August. And so one thing that's really important for emergency medicine is you not only need letter of recs, but you need like specific letter of recommendations. They're called SLOs. So emergency medicine, I think OBGYN and dermatology, correct me if I'm wrong, those need like specifically tailored letter of recs that have to come from, like for me, for example, it had to come from an ER doc. I couldn't just use like a family medicine or internal medicine doctor. They had to come from them. So that meant that I had to do my EM electives very early, as early as I could, since the application closed in September. I needed to get two letter of recs as soon as possible. So that's something I recommend, is trying to get your elective or your audition rotations done as early as you can, maybe June, July, August, September, because you really realistically only have about 4 months to get as many letter of recs and slows as you can. So yeah, so I applied in September, ended it in September, and then by October you'll start hearing back for interviews. And so for me, during the interview process, they ask like the basic questions, the ones that you can, find online. So you have to be very prepared to get questions asked like, tell me about yourself. Why did you decide to do this program? Why emergency medicine? Or why whatever specialty you decide to go into? Or tell me about a time when. There's like 100% guarantee that you will get asked those questions. And then for me, for example, emergency medicine, they really, really, really care about like your personality or your hobbies or what you like to do in your free time. So I got asked a lot of those questions. And I got asked a lot about my personal statement. So just know that anything that you put on your application, there's a high chance that you will get asked about it. So certain specialties have certain things that matter. So, for example, emergency medicine step score was not as important. Research was not really looked at very highly or as important. It wasn't like a priority to get research done. But I know if you apply to like more competitive specialties like anesthesiology or dermatology, you do need research. You do need a high step score. So for me, it really relied heavily on like my evaluations from my core rotations and my letter of recs, which are the slows. And then, yeah, so during rotations, like Rashid was saying, just make sure you are just very eager, asking a lot of questions, genuine, very outgoing. Anytime you're asked something, just be, or like anytime there's an opportunity to see a patient, go for it. Try to stay as late as you can. Just like make as good of an impression as you can. And then even after applications, the cycle closed and I had applied to all my programs. Once I started getting interviews back and I had interviewed, the programs that were in my top, I would email them after and let them know that, listen, like you're in my top. I really like you guys. Like, and I would keep emailing them like periodically until match day, which was in March. And then that just shows that you're really, really interested. Because at the end of the day, they get like 700 applications. A lot of these programs get, each hospital gets like 700 applications, if not more. So if you're constantly emailing them and letting them know, like, you're on the top of my list, I really want you, like, you'll end up standing out in that way as well. And so then when it came to ranking like the hospitals, so once you interview, let's say you interview at like 15 places, you have the opportunity to rank all 15 places. And so for me, one thing that was really, really important, it was geography. I really wanted to stay close to home, stay near family. So I think that helped in terms of ranking. So for you, just find the one thing that is very important to you and then rank the hospitals based on that. So whether you want to go to like an academic program, or if it's based on geography, or it's based on just like how you like the program in general, like if you vibed with everybody. So I think that's, to me, like a very important tip is just, and when it comes to ranking, just find something that's important to you and rank all these hospitals based on it. Um,
Yeah.
and I think that's it. I don't know if you guys
And
have.
do you think that there's like certain thing that you said in an interview that made a program like the program accept you or like take you for their like is there any certain things you said?
Yeah. So I think my specialty is a little different because for emergency medicine, it's like the stereotypical. Like they just want to make sure that you're like a good fit and that you have like hobbies outside of medicine. They're not very like um I don't know how to explain. Like they're not very nerdy. So they ask me a lot about my hobbies. So if anyone's applying for emergency medicine, like make sure you have in your application there's a section for hobbies. Talk a lot about what you like to do because I felt like most of my interview was them just talking about that. And then they also did ask like I had specific like patient encounters in my personal statement. So they asked me about it. They're like, "Okay, can you elaborate on, the specific patient that you saw? How did it make you feel?" Um, but yeah, but I know like my friend, she applied to OBGYN and she had a lot of research. And so she had to do a lot of research. So during her interview, she got asked so many questions about her research. Like tell me about your research. How did you get this data? Why do you think this outcome was the way it was? So I think every specialty is a little different, but for emergency medicine, it's more personality fit.
Yeah. I think I heard that about other specialties as well, that in the interview you will expect them to talk about your experiences and your like scores and what else, but they really focus on your personality, on what you expect from the hospital, what like environment you like to work in.
And always have questions for them. Like at the end when they say, "Do you have any questions for me?" Always come prepared with like 3 or 4 questions that you want to ask them. Um, and then yeah, it's, the interviews are not bad. I feel like they're just those generic questions. They'll always ask you those easy 4 or 5 questions. So if you have those prepared and you've memorized them and you know how to, talk about yourself, I think you'll be fine.
Yeah. And like, how did you know you wanted emergency medicine? Like, how, if someone is thinking between two specialties, yeah,
Yeah, so for me, I always like enjoyed it, even going into medical school. It was like in the back of my head. But I feel like emergency medicine, you get like a bad rep. They're always talking about, oh, it's burnout, oh, it's crazy, it's like the hardest field, you're gonna be working crazy hours. So like I was like, no, halas, like I'm not gonna do it. I don't want to do this. And then I did all my 6 core rotations and I didn't really like any of them as much as I liked being in the emergency room. So it wasn't until I did my trauma surgery rotation where, you're spending anytime a trauma comes in, you're in the ER, where I was like, no, like this is the place for me. I liked like the excitement of it. I liked being there, helping in the moment, being the one person that everyone looked to help. I liked that, it was a fast turnover. And so I didn't I don't like rounding. I don't really like follow-ups. So all together I felt like it fit me and like my personality, it fit like the hyperness, the upbeat. So yeah.
yeah. And do you like, I'm not sure if you know this, but are there like any IMGs that are like that matched with you into emergency medicine? Like, is it
Um,
available to?
Yeah, definitely. Yeah. So emergency medicine isn't one of like the really competitive programs like dermatology or anesthesiology. So a lot of IMGs will match in it. It's and like I said, step scores like are not that important. Research is not that important. It's very weighed heavily on your letter of recs. So if you're an IMG that's, at a hospital in the States and you get a really good letter of rec, I think that will mean so much more than any test score.
Yeah. Okay. Thank you so much, Dr. Danya. Is there anything you want to add? Anything you want to give advice on?
Um, I think mm, nothing now, but if you guys have
Yeah.
any questions, let me know.
Yeah, I think yeah, in the Q&A we'll have more to talk about. Okay. Um, Dr. Adham, are you ready to?
Hi, all ready. Ready when
Yeah,
you want me to.
yeah,
Good to go? All right.
yeah. Sorry.
So,
Yeah.
hi, I'm Adham Kamr, IMG, Damascus University graduate 2022. Um, so the US, I believe, wasn't my plan A, but I landed here in the States 2 years ago, and I kind of very hesitant about the entire thing. I was weighing very like heavily weighted with step one, and by accident, I lived right across the street from Mount Sinai, and I did not know anything about it before. I looked it up, and it was one of the best hospitals in the country. So I had a phone call with my dad, and I was like, "Okay, stuff are breading up. I'm really finding it nice here." And 2 years later, even though my father isn't around anymore, but I made his dream come true, and I matched into that specific hospital. So the match process has been quite of a journey for me. Bear with me. I'll go through the bits that I feel I'm quite good at. Because when it comes to doing the steps, when it comes to doing the USMLE stuff and studying, I'm not sure I'm the best one to give you answers about that. My scores weren't that good. Uh, I passed step one with a terrible amount of exhaustion. Step two, my score is 231, so very like I think beyond the median score. Um, but what I think I can really help you with is how to write very good personal statement, finalize your application the way that that kind of fits what you're interested in, and interview. I'll start with the I'll start by saying that I'm so grateful for SAMS. This is not sponsored by SAMS by any means, but I'm just like they did a great stuff that really shaped my approach to the entire thing. They matched me into a doctor in Indiana. He's a family medicine physician, and it's just it really opened up like my eyes to a lot of stuff that I wasn't aware of in terms of interaction with patients, what are the patient interested in, how the hospital system work, and it just that was a great thing that SAMS did. The second thing was the mock interview. So please, when they start, they put the form to subscribe to the mock interviews that they do online. They did on Telemus, so it's the same platform that you'd actually be your real interviews at. And they were great. They really gave us actual physicians, and they like most of the questions they asked us there were the same questions that we had in our interviews. So please do that. And I'm so grateful for the fellow panelists that I'm with. Such an amazing stories, and I'm so honored to be one of you guys, honestly. All right, back to the USMLE stuff. I did my exams, I think it took me 2 years. I did not do them through my med school. I came here to the States. I did the first, I was with Kaplan Medical, so it took me a while. And then I started the process of applying. So I had to do as much rotation as I can, as like within 2, 3 months. And I made sure that I did do those rotations as exactly where I would like to practice. And one of those rotations was the hospital that I matched into, Mount Sinai. And I'm so glad that the third panelist has mentioned how it's important to be as active as you can there. And I think the ones that really did it for me there was the nurses. Uh, we really worked together. They helped me to kind of socialize and to kind of introduced me to a lot of the important doctors that were there in the hospital, and it really did a lot of difference. That's the first thing. When I started making my application, I did use a lot of ChatGPT, but you got to make sure that you're not using ChatGPT to write you stuff, using ChatGPT to guide you what are the stuff that you should be writing about. So whatever you write, so my technique was in writing the personal statement. I do like writing before, so it's something I did enjoy and I had a lot of fun with, and I helped like 8 or 9 of my friends writing their personal statement. But I try to build up a technique where you can really tell a story and you wouldn't make the reader or the program director or whatever doctor that's reading your personal statement bored with it. So I kind of lined 5 big stuff that you want to tell about yourself for the program director. I was like, okay, I'm resilient. Everyone is resilient. I am kind of multicultural. I have a great exposure for literature or like, just I'm whatever stuff you want to portray there, just write it down. And then on everything that you have there, so resilience, for example, we're Syrians. Of course, each one of us has a great, amazing story in resilience. And you can just bring up 2, 3, 4 lines in a story or something and you put it there. And then after you kind of write 3 or 4 lines about each of these stuff, you kind of reorder them in a way where it kind of makes sense and put a caption in the beginning and finalize it with a way that you kind of make all these stories make sense and portray them as my stories, my experience are aligned exactly for your program and what you're looking for. And that made, even though I had very small amount of interviews, I had only 6 interviews, but in every interview that I had, they mentioned that the person statement was one of the most powerful person statements I've ever read. So make sure, because the chances of getting a program director to really sit down and read person statement is not that high, but once they do, you got to make sure that you're really impressing them. All right, this is regarding a person statement. In the application, after writing everything within the application, I made sure that I'm giving it back to ChatGPT and asking it, okay, this is the stuff that I wrote here. How do you think I can make it? If this is like rated out of 10, and if it gave me, okay, this is a 6 out of 10, I was like, what are the stuff that I can do to make it a 10 out of 10? And it would give me some suggestions. I wouldn't do all the suggestions that ChatGPT would give me, but I would definitely take it in consideration and see what's really true about it and how like make it authentic, not just taking stuff that a robot has done and just pour it out there because it would look so obvious in your application. So make sure not to do that, but use the guidance that ChatGPT can give you. That's another thing regarding the application. In signaling, I made kind of a chart where I was very much focused in matching specific areas. I only applied to New York, Chicago, and Boston, and then I kind of freaked out the day before the ERAS, and I applied for like 100 another application. But still, without the entire process, I made sure that I'm really focusing my attention on those 3 cities. And when I was signaling, I had a sort of thing where
Can you
I
tell us what's signaling? Maybe we have some like new students.
absolutely, absolutely. So signaling is something that US has done through the last 2 years, I think, where they give every applicant the opportunity to show the programs that is really interested in, that is interested in it. So once the hospital would review your application, they would see in their system that you've signaled them. So you are very interested in their program. And for internal medicine, we had 13, I think, 12 silver and 3 gold. Gold is very, very interested. Silver's like very interested. And I made sure that because they're so precious, you only have 15 and got to use them wisely. And the way I did it was I did put around 30 or 40 programs that I'm really interested in, and then I gave each program points based on whether location, whether reputation, whether people I know in the program, because that matters a lot, having somebody in a program that is rooting for you. And every program that I just took, the programs with the highest scores, and then I signaled those programs. And to be honest, most of the interviews I had, which are not many, were from the programs I've signaled. Um, yeah, that was regarding signals, interviews. That is something I worked a lot on, and I do believe I sort of hacked the system. I'm sorry, guys, who found this. I did put a lot of weight into interviews because I didn't have much, and I really wanted to make sure um to get one of those spots. You can call it obsession, you can call it stalking, but before every single interview, I would look each doctor that I'm interviewing with, whether they're X, whether LinkedIn, whether research. There's a doctor that I read there, and like she was Dr. Marsana, a geriatric physician, and she wrote a book, and I've read her entire book before the interview. But it just make sure that you're really putting a lot of effort in that interview. And while you're doing that, write notes about, okay, this doctor is very interested, for example, in DEI. This doctor is very interested in reaching out to underserved community. This uh, doctor is a feminist. This doctor has great family values. And don't fake your interest in that. Just try to bring out from your personality stuff that are aligned with that doctor. So if a doctor has a very strong bond, she's like a female doctor, have a very strong bond with her kids, try to make sure while you interview to bring out the fact that you have a very strong relationship with your mother. And like your mother is the one that inspired you to be where you are, what you're doing. And you can see how the face sort of brighten up and like you really hack them. Like it's magical, trust me. Another thing that I think really helped was before every interview, I would sit down, try to write an open letter. I'm not sending it to the program. It's just more for myself to turn in what this program wants. So if it's a program in Florida, for example, and they have like a lake next to it and very sporty, and this is like a lot of Hispanic people, you can just bring out that, okay, I do like working out a lot. I do imagine myself running around that lake. I do imagine myself serving a Hispanic community because I'm trying to learn Spanish myself. And just bring that to the table. If I'm applying to a program in Brooklyn, for example, I'm telling them I'm very interested in serving underserved community. I've had a lot of exposure with African American community. I did this, I did that. So bring out the stuff in your application or your personality that aligns with what this program is looking for. It really makes all the difference. It's not lying, just highlighting. You're highlighting what you have for them to hear. What else? Okay, the entire journey is it's quite daunting. It's not easy. Dr. Shi said that. It's been yeah, it's not especially while you for me, the most harding part was waiting for the interviews. It was so hard. But once you get the interviews, once you get over that step, honestly, it is so fun and it's so doable. We Syrians has been through a lot. Each one of us has an amazing story. Don't shy away from it. Wear it, embrace it, be proud of it, and honestly, it's very doable. And I do have skin in the game. I do have a sister that is gonna match in 2 years, and I got two mentees that I'm so proud of. So I do want them to match in the good places. And when you match in a good place, you're making sure that the people after you are gonna match in a good place too, because they've seen, look, there's a physician doctor that's from Syria, and he's so good. He's very passionate. They're very educated. They're very articulate and communicate well with the patient, and that gives a very great attitude about all of us Syrians that are in this together. So please, your success is something that we're all interested in, and don't hesitate to reach out for any question or anything that you have in mind. We're in this together, and yeah, pray, meditate, uh, be authentic. What else? I've wrote some notes here.
I think
Yeah,
it's
I
very
think that's
interesting
about it.
what you said about interviews, that like you stalk people before you go into interviews. It's a new concept. It's actually like really important that like everyone likes, like they want to talk to you, but they also want to talk about themselves. Like they want to find a common ground that they can like discuss with you, that will like keep you in their mind when they're thinking about applicants. They'll say, yeah, I had this applicant who talked about that and that, and they seemed very interested. So I think this is a new concept, but it's very interesting and it's very like important to focus on.
I'll give you another example. So there was a doctor in Sinai that was part of an expedition, the Met, and she's at the same time, she did a podcast like 5 years ago, and I brought out a bit of our thing, then I did tell her a bit of podcast, and then I just said it clearly, like, look, I've looked you up and I've seen a podcast of yours. It was an hour and a half and I enjoyed every bit of it. And I discussed some of the stuff that she mentioned in the podcast. So even if it is so obvious, even if it is kind of a bit scary, it kind of shows them that you're very, very interested in this program and you're doing the work. That's what matters.
Yeah.
Yeah.
Exactly. Thank you so much, Dr. Adham.
You're most welcome. Thank you
We'll
for
have
having me.
time for questions at the end also. So you can write them from now, but we will have a session at the end. Dr. Ghena, are you ready to?
Yes, let's do it.
Yeah.
All right, salam everyone. My name is Ghena Krdi. I am a fourth-year medical student at the University of Arizona in Phoenix, Arizona. Born in Syria, but raised in Arizona. I will be graduating next month, and I matched internal medicine at my home program in Phoenix. I am very happy to be here, and I actually took some notes from my own like application cycle that I was going to share with students in my school. So I thought I'll kind of like tell you a little bit about my story, but kind of share some of the tips that I either got from my school throughout the process, or that I learned myself throughout the process. And, you know, hopefully that's helpful. Obviously, my experience is a little bit different because I am an American graduate. I tried to make sure to include things that would be helpful for both MD, DOs, and IMGs. But just know that my experience comes from like an MD student who matched at technically their home program. So it's a little bit different. I will start by talking about the ERAS itself. One thing that my school stressed a lot at the time was making sure that you know the deadline for the ERAS. I believe our time, it was about September 24th. Because what happens is if you submit it after that date, then it shows a different date on your application. If you submit before September 24th, everybody will have the same date on their application, which is the September 24th date. That date might be different for the upcoming cycle. I would say continue checking the website for the ERAS 2026 timeline. But the thing is, when you submit later than that date, then it shows a later date on your application, and then your application is sent to the programs at a later time, which is not really to your advantage because that's kind of already putting you at a lower chance of getting an interview at a program. So just be mindful of the timeline, be mindful of when the date or the deadline is or the primary deadline, I guess, for ERAS, so that way you're not missing the deadline. That doesn't mean you can't apply after, it's just would show a lower or a later date on your application. And then next comes your program list. There are three main things that I would say are very, very important when making your program list. Number one would be geography, or for me at least, it was geography. I knew I wanted to stay, like my family's in Arizona, I'm from Arizona, so I knew I wanted to stay either in Arizona or somewhere around the area. In the application, you do get to preference regions, which some people like to do that if they are interested in being in certain regions. And then some people, in order to increase their chances of getting interviews, they would say that they have no preference. But when you say you don't have no preference, you really should not have a preference of where you go. So if you do have a preference for certain regions, and it's called regions because it's not states, it's actually groups of state per region. And that will make sense once you open ERAS. So each group of states will be considered a specific region. And then just you can still have those preferences. In fact, it helps you with getting interviews in a sense if you're actually interested in certain regions, because then they'll see that you preference a certain geographic area, which means you want to stay there. So it would help the programs know that you actually want to be in that area. I personally did use that tool on ERAS, and one of the regions was obviously around my state of Arizona. And then, so that's geography. Number two would be the type of programs. There are a few things that go into a type of program. I wrote a few things down. So academic versus community. For internal medicine, there are two main different kinds of programs. There's academic programs, which means programs that are very research heavy for the most part. So usually they're more directed at training or they're more directed at having trainees at the hospital and care a lot about research versus a community program where it's a lot more focused on the clinical aspect of the training with not so much focus on research. The other thing that's different between academic and community is fellowship matches. And so both are good in my opinion. I applied to both academic and community programs. I think it's a really good idea for people to actually apply to a mix of both academic and community. Academic programs or university affiliated programs usually tend to be a little bit more competitive. So that's why I say it's a good idea to apply to a mix of both. If you're interested in certain regions, sometimes there might not be that many academic areas in those regions. So again, community programs are usually more prevalent. In my experience, people who are actually set on certain fellowships usually would want to go to an academic program because generally they'll probably have that fellowship already available at the program. And so it's like an easier pathway to that fellowship. That doesn't mean if someone goes to a community program, they can't match. Some community programs do have their own fellowships as well. So just wanted to mention this. A few other things is fellowship options. Obviously, again, if you're interested in a certain fellowship, then you would probably want to look at programs that have that fellowship available. The other thing is looking at the types of applicants that they accept. So take a look at what kind, like the residents that they have. If a program is known to, for example, only accept MDs or only MDs and DOs or only IMGs, just that gives you an idea of how much they're likely to review your application. That doesn't mean that if your credentials don't match the resident list they have, that you don't have a chance there. It just means it's probably a lower chance. So just be mindful of picking a variety of programs that matches your application. And then home program versus not. So sometimes people really like I think the thing about home programs is I personally really like mine. So I really wanted to stay there, and I obviously, that's where I matched. But sometimes about what it is about a home program is you rotate there, you know it so well, and it gives you a very good advantage of knowing if you actually want to stay there or not. And sometimes if people don't want to stay there, then they'll probably still apply to their home program. I think a home program is always a good safety net just in case. But I think having that direct access to a home program does allow people the opportunity of using it as a safety net if they don't like other programs. And if it is a program that you're really interested in actually being at, kind of like my situation, then it also gives you an advantage of basically, you already know the people, your letter of recs can easily come from them. You can easily tell them, like, I really want to stay here. And usually it would work out the way it worked out for me. And then the only thing I already added to this in terms of like types of programs is like looking at the schedule. I know a lot of times we don't have access to the schedules that usually comes during the interview, but sometimes you can ask people who you might know at the program. I personally didn't want to be at a program that would have 24-hour shifts, for example. IM generally has gotten rid of the 24-hour shift rule for the most part. There are still programs who do that, but in general has gotten rid of it. A few other things are like, what is their night shift like, schedule, how many inpatient months do they do, how many ICU, because the ICU rotation is considered a really like tough rotation, how many of those do they do every year? So I would say like keeping track of their schedule throughout the interview process might be helpful in, helping you in deciding what program you want to be at. So yeah, geography, type of program, and then the number of programs. The number of programs you apply to depends on, again, the other two factors, but also your application in general. I personally applied to about 40 programs. That number differs, again, from person to person. It also differs if you have a home program versus not a home program. It differs if you have done away rotations versus not. And then I'm sure like every friend who I've talked to who's an IMG applied to many more programs just to increase their chances with matching. So I would say, again, if you're an IMG, definitely talk to an IMG friend and see what their average number of applicate or programs was. So the other thing that my friends have talked about is connections. I do really believe in connections. They do make a big difference, in my opinion. If you know someone at a place or an attending or a resident, if you really want to be at a place and you know someone at that place, I would say definitely try to get a recommendation letter from them because they really look highly at that. But even after ERAS is due, if you know someone at a place who knows you and can speak about you, like your personality and how good of an applicant you are, then definitely reach out to them and ask them to share like good words with the program director or someone who's part of the decision-making process. We talked about signaling a little bit. I did actually include a slide on signaling if you want to open it to her.
Yeah.
Yeah, so signaling is actually something that, from what I heard, is something that's new this year. I think they had it before, it was just not used as much, but this year we actually really used signaling. Signaling is basically you, like someone else mentioned, it's basically you telling a program that I really want to come to you. So that's like an added to you specifying a geographic area. This time you're actually telling specific programs I really want to come to you. It's different per specialty. You'll see for IM, it's about 15 signals, 3 gold, meaning I really, really want to come to you, and then 12 silver, meaning I want to come to you, but not really, really want to come to you, I guess. It says, when I looked at this last night, it did say you don't have to signal a home program or away rotations. That isn't necessarily always true. Our home program wanted us to actually signal them, and I did give them a gold. And so I would say double check with the program if they want you to signal them or not, even if you did an away rotation or if it's your home program. The other thing about signals is, I will say from my own experience, it is the places that you'll generally get interviews from. So if you're really interested in a place, you got to signal them. They'll probably give you an interview. Out of the 15 signals that I put, I think 13 did give me interviews, and then 2 other ones did not. The other thing about signals is you can signal a random program that you have. Like one of the programs that did interview me is in a completely different state. I have no connections with them, no recommendation letters from them. It did probably seem odd to them that I gave them a gold, but I just wanted to, try my luck, I guess. And then you can use them however you want, especially if it's like, I would say don't give it to a lot of reach programs. And by reach programs, we mean programs that are like very, very competitive. But I would say like you can easily probably give up 1 to 2 signals to a reach program and just see what happens.
Yeah.
Very
And
quick. Yeah, sorry, go.
Yeah, it's okay. Does the ranking happen like after you get your interviews or before? Like when do you rank the hospitals you want to?
For signaling or the actual ranking?
No, the ranking, because you said signaling is before the interviews.
Yes, signaling is when you apply, when you submit your ERAS.
Yeah.
Ranking happens after you're done with interviews. That usually is due February, end of February. For us, it was, March 5th, I think.
Okay.
Yeah. Yeah, and I'll say a few quick things about interviews in general. Obviously, there's a lot of tips on how to do well on an interview. A few tips that are outside of the interview itself would be to schedule your interviews at desired programs kind of midway through the cycle, so that it's not like earlier on where you haven't honed in your interview skills, and it's not too late in the process where you're like burnt out from interviews. So that for internal medicine, that's usually end of November. If they ask you about long-term goals, again, that's for internal medicine, and you're interested in a specific fellowship that they don't have at that program, probably don't tell them, because then it would look like you don't want to come to them. Or maybe tell them, this is one of the things I'm interested in, but I'm open to other options. So kind of try to match what they can offer. That way they know that you want them. And then it's up to you to decide if you want to rank them or not based on the fellowships they offer. Second looks, they say that it doesn't matter if you attend or not. It doesn't, weigh into the decision process. I don't know if it actually does, but I will tell you, some of the second looks I went to, I made connections and told people that I'm interested in certain programs. And I think that probably helped them rank me a little bit higher. So I don't think second looks change if they like you or not, but I do think it might change how high up they might rank you. Again, this is not fact checked. It's just, but they say it doesn't matter into into what they rank you.
They send you that they want a second, or do you like contact them for a second look?
Second looks, usually the program has to contact you. So some programs don't do second looks. So after an interview, so they give you an interview. After an interview, if they're doing second looks, they'll tell you we are doing second looks, and there'll be certain dates. And then you can sign up to one of the dates. They always tell you it doesn't matter if you attend or not, so it's optional to attend. I would say if it's a program you're interested in, 100% go and attend that second look.
Yeah.
You don't know, how it will benefit you.
And like, will they ask you more about their program, or what will you talk about? Like, you did your interview.
Yeah, so second look is for them to impress you now. Interview is for you to impress them with your, like, who you are as a person and your application. Second look is for them to now show you their hospital, show you their residents, show you around, I guess. Maybe explain their schedule a little bit more. They should say this in the interview, but it's kind of like for them to tell you, to like impress you. There was actually one specific second look that I went to. I was thinking very highly of the program, and then I went to, and I was like, actually, I don't want to be here. And so it did go lower on my rank list. So it's a really good idea to go. I actually went to all the second looks that are, again, in my preferred geographic area, but I would have went out of state too if I felt really strongly about a program out of state.
Yeah, I think I didn't know about second look, so I think it's great that they can like show you that they're interested and try to impress you, and as Dr. Rasheed's saying, like, for IMGs, always go to second looks. We need any chance that that's gonna help us like get into the program we want.
Agreed. I think it's a good idea for everybody, and regardless if they're like MDDO or an IMG. Definitely go to a second look if you're interested in a program.
Yeah.
And I guess one last pearl with interviews. This is something that the dean of my school taught me. She said to keep an Excel sheet to fill out after every interview. On that Excel sheet, so after every interview, I'll put in the location of the program, the type of the program, what fellowships they have available, their program size, the educational content, if I would be happy with it. If they have like resident research, my feeling about what the culture is like at the program, because you want to be at a place that's going to be supportive and nice, and then your overall gut feeling from the day. Yeah, and then we talked about rank list already. They say they say for internal medicine, if you rank 12 to 15 programs, you've got like a 90-something, like a 95+ chance of matching. That doesn't mean you won't match if you rank less. It's just, that's kind of like what statistics have been showing. I would say rank every program you interview at if you think you're okay going there. If you can't see yourself at all going there, then don't rank them, but definitely rank every program you interview at. And someone else also mentioned sending programs an email telling them you're really interested. I also agree with this for internal medicine. You can send them, you can even, if you're interested in ranking a program as your first choice, you can even tell them that. You just can't do that to multiple programs. You can only do it to one program. So if you're really sure you want to rank a program as your number one, you can tell them that. You just can't do it to multiple programs, because then you'll ruin your reputation if they actually listen and you don't match with them. So only do it to your number one if you actually want to rank them number one. Yeah.
That's great. I think we can now, if you're done, we can move on to the Q&A. I think many people are waiting for that too.
Duha, I just want to mention a couple few things before we go into questions.
Yeah.
Can I do that? Yeah, so for IMGs, guys, apply wide. Do not apply to, unless you're one of the top applicants in the country, you're very confident. But other than that, apply wide to a lot of programs, because the matching rate for IMGs is 50%, so around that 50% or more. Second thing, when it comes to signaling, signal wisely. Know what programs you are signaling. Do not dream high. Know your limits. I'm gonna be honest there. If your scores are not that good, if you're not a very, very good applicant, do not signal some of the high tier universities. Signaling is very important. I read somewhere NRP data shows that only 20% or less of the people who matched into programs they did not signal. Most of the people matched into program they signal, including myself. What else? Second looks, always go to second looks, make whatever effort you can do to show interest in a program. I want to mention also that when it comes to signaling, if you have very solid connection in one program, the question is, do I waste the signal in a program that I have very good connections with? So I dealt with that myself. I think for IMGs, do signal, even if you know, I personally know the program director of Detroit, and I still signaled them because you want to show your interest in any means. Now, some people would disagree for American graduates. If you did a away rotation, if you have very good connection, probably you do not want to waste a signal there because you're gonna most likely get an interview, especially if you honored your rotation there. So signaling is a big thing. Interview, I want to quickly mention as well that at SAMS, we have a interview workshop that happens before the interview season. If you are, make sure to attend this workshop. I myself gained a lot of experience through this workshop. I interviewed some associate program directors, fellows, and some faculty in some good universities. They gave me a lot of feedback. I used that in my interviews to my advantage. And in SAMS, we are planning to do a personal statement review, probably campaign or also workshop on how to write. So if you're interested, make sure to attend that as well. That's going to be helpful for you.
Yeah, that's right. Thank you. They're asking like I think as IMGs we wonder how to get observerships. Like, do we email professors? How do we get these observerships and experience like US experience that we need to add to? Anyone who knows can answer. Like I think
Right.
that's it. Yeah.
I think I can I'll talk about my experience. So my rotation were the ones that were kind of facilitated by SAMS. That was the first one. The second two, because I had no time, I did it through agencies. So agencies are always an option. They're not the best option, but they can get, like, if you want a specific program, a specific place, I do believe agencies sometimes can be the only option. But connection is also a great option. A lot of the time it works. And yeah, keep reaching out. I say it's a great thing. Just write a form of email and adjust it to whatever institute that you're sending it to, but always keep this form on the side, and whenever you kind of hear someone or see someone or like get to know that there's a specific doctor practicing specific doctor, don't hesitate to send them that email and let them know that you're interested, whether in rotation, research. Always try to reach out. I would say it would do no harm.
Yeah. And
Anything you'd like to add, Dr. Rasheed?
Yes, I do agree on this. Now, it depends on your universities. If you're an Syrian IMG in Jordan or for Turkey, I know they do some exchange programs, so it's going to be easier for you to go through a program through your university, do an elective here while you're a medical student. But for Syrians from Syria, it's very challenging. You need your connections. I'm happy to connect any of you guys who are interested in neurology with doctors that I know. SAMS has a very good program, helped a lot of people to do observership across the country. It's called the Observership Program. I think it opened up last month, and it happens in cycles. Next cycle will be at the end of this, probably not the end, probably like around July. And what else? Yeah, keep reaching out, just like Adham said. Connections for IMGs. You know, a doctor lets you in the hospital, gets you the sponsorship letter, you get in, you do your observership, through this observership, you connect to another doctor, do a rotation with them. So that's how it goes. That's what we gotta do as IMG.
Yeah. And is there anything like I think someone asked, it's Ivana, that they can do as like students that are going to graduate now and they're still like in Syria or another country? Is there anything that will help them other than studying like for the USMLE and like research, or what advice would you give?
A student who just graduated from Syria, right? That's what you're asking about.
Yeah, who's going to graduate, I think, yeah.
Or about to graduate. No, in Syria, take the steps, of course, study for the steps and take them. Now, if you can come to the US on a J1 visa, just like myself, get a research position, that would be great because J1, you're gonna get accepted. The chances are very high. I don't know what the recent changes, if anything, changed, but to my knowledge, J1 is almost guaranteed. Come to the US, do some research, probably a year or two during this 1 or 2 years. You're gonna do some clinical rotations. Coming to the US is important to match. It's almost impossible to match without coming at all in the US, unless you did your training, a couple of years of residency in Qatar, for example, or you're working in Beirut in the American university they have there. There's a chance for you to match. But from Syria, you gotta come here not only to get connections and letters, but also to get accustomed to the culture, to meet the people, to know how they speak, how they act, how they behave. So you are in line with the American culture is very important. During the interview, they do not, the directors and residents and faculty, they do not want to feel that you're an outsider. You do not know how to speak, how to act. It's okay to have an accent. I myself have an accent, but you gotta speak properly and know how to behave around Americans and the American culture. And that you get that from coming to the US. So try your best to come. If not J1 visa, get a sponsorship letter from one of the hospitals here in the US. Go to the embassy and apply for a B1 visa. A lot of Syrians here, they came on a B1 visa. But it's challenging. I'm gonna be honest, it's not easy, but it's doable.
Yeah. So like while in Syria, we focus on the USMLEs or other country, but mostly we have Syria.
USMLEs, try to come to the US. If you can get some papers out while you're in Syria, probably a review or something, that would be very helpful to get a research position.
Yeah.
Because you're gonna have higher chances of coming when you're already done some research.
I think Bana is also asking, is it possible to make a research fellowship after graduating? I don't know if Bana's here. I think she means after graduating medical school.
You mean like a postdoc fellow or research assistant after graduating? Of
Yeah,
course.
I think this is how most of Syrians like go to the
Yeah.
US. and
Yeah,
research.
a research position. Even Americans, by the way, I know a lot of Americans, they do a research year after they graduate. So it's possible, it's feasible. Yes, Banner, you can do that. Absolutely, you can do that. But it needs connection. Like myself, I'm a postdoc at Wayne State. I came here, the person before me was from Egypt, also an IMG. Somehow I got to that person. Probably some of our IMGs in Syria want to hear this story. I was looking, I sent more than 100 emails to universities, did not hear back. I heard back from 2 universities, one in New York and the other one is Wayne State. And when I got the email back from the program, from the PI at my lab, I went online, looked at their members. One of them was Egyptian IMG, stalked them, went to their social media, sent an email. They connected me to the PI. I got the position. That's how I did it. It took me a lot. At some point, what the hell, man? I want to go to Germany. Screw this. It's easier. But then luckily I got it. By the way, I had another in the same 10 days period. I had the American embassy interview at the American embassy interview there, and the German under the German embassy. So I decided to go with the American one. But what I'm saying is, that's you got to reach out to people.
Yeah, because like
Fellows, they help you a lot. Now my PI now, he's asking me, do you have any replacement? So I'm gonna bring somebody for them, but unfortunately they do not sponsor visa at this point.
yeah, because some like professors have like positions and things to offer, but you have to reach out. Like they won't know you for like without like trying to email them, read the research. And I don't know if this is helpful to have a profile on like social media or LinkedIn or
Sure. LinkedIn is one
LinkedIn.
helpful way. LinkedIn, X. Some people post about postdoc positions on X. The IMG groups on Facebook. Some fellows who are leaving their spots, they post about that on Facebook. these are some ways that you can get positions. I know Mayo Clinic, they sponsor a lot of visas, some other University of Michigan, probably, Wayne State, there are some big names that sponsor visas for IMGs, and they're IMG friendly.
Yeah, Fatma is asking how to make, maybe Dr. Danya or Dr. Ghena can help us with this, how to make the most of a rotation, like what are they allowed to do in a rotation, and do they have to tell the doctor or professor like how about the LOR or like the letter of recommendation before, or how to write it? Whoever can answer this question.
I can give my input on that. So in terms of rotations, a lot of the hospitals that you will be at, you won't have Epic access because you are just a student. So what would happen you'll go in, and then the resident or the attending, for example, for EM, they'll tell me, okay, there's a patient that's coming in with nausea, vomiting, go get H&P on them, history and physical. And so you'd go talk to the patient, and then you'd come back and you'd present to the attending. You'd give them, the H&P, you tell them what you think is going on with the patient, how you would like to treat them, what their next steps are, and then you wait for the labs to come back. So then once the labs come back, you can just ask the doctor, hey, what are the labs? And then you can go on from there. And so then that's like one thing you can do, because a lot of times you won't have that internet access. And then during the observership, they just really want you to, constantly be checking on the patient, making sure they're okay. Let's say the patient was supposed to get like an EKG done. Follow up in like 10-20 minutes with the nurse, see if the EKG did come in. If you have the results, take it to the attending, let them know like, hey, these are the results, this is what I think it is. So you don't necessarily need like computer access or Epic access for it. And then just making sure you attend the didactics. Didactics are once a week, and it's held for the residents that they have to go to. And it's basically like teaching. So once a week, they hold like a 4 or 5 hour session where they just teach the residents about certain topics. So make sure you go to those, make sure you always have questions, you're always interested. And then in terms of the letter of recs, so you can ask them, like, physically to the doctor, you can ask them if they would write a letter of rec to you. And if they agree, it's all through the ERAS system. So you just input their email, their name, and then ERAS will send them the template, and then they just fill it out, and then they send it to the ERAS system in like as a whole, and you won't get access to it. So you won't know what the letter of rec says. So make sure whoever you're asking, they will write you a good one, because you'll never know. And once it gets sent, you can't unsend it. So that's my advice on that.
Yes, thank you, Dr. Ghena. Dr. Danya, I think Dr. Ghena wants to add something.
Yeah, I guess the only thing I would add to this is on rotations, one thing they really care about is that you have a learner mindset along with being helpful. And so sometimes when you make a plan, it's really nice if you can look at UpToDate or AMBOSS for what the first line treatment for something or what the current guidelines are. And when you tell them like, oh, I read about this, it usually stands out a lot when you tell the attending, oh, I read about this or I looked this up. And so that usually makes a person stand out. And then for recommendation letters, if you ask for a recommendation letter from someone, it gets added to your ERAS, but you don't have to send it to all the programs. You choose what recommendation letters you send. So don't worry about if you have more letters than you need, or for example, you have a letter from someone that you're then like, oh, I don't really want to use this letter, or maybe I don't think this is a good letter. Don't worry about that. It's on your ERAS, but it's not necessarily sent to programs until you send it. So still ask for that letter if you feel like it would be a good letter, and then you can decide later if you want to use it or not.
Okay. And Muhammad Bashir is asking, when applying for 2 specialties, like how does the signaling work? Like, can they signal 2 programs, or is it like, do they have a total signals allowed?
I was just typing an answer for it. So I did that because I applied for internal medicine and family medicine. I'm not sure. I think for neuro and family, they have different things. Neuro and internal have different things. But for me, I applied for internal medicine and family medicine, and I had the 15 for internal medicine and I had 5 for family. So you would get whatever specialty you're applying for, you would get the signals for that specialty. If you're applying for 4 or 5, I think you still be getting the amount of signals that dedicated for each specialty. I think if somebody has no problem with the specialty, this can be used as a way to kind of broaden your chances in getting a spot. it would be so hard to justify with an application, but if that's what you're after, yeah, wouldn't it wouldn't be a problem, I think. I'm not sure if anyone has a different answer.
So they like they have like, for example, I think 12 for internal medicine and maybe 6 or less for neurology. Like they will have the whole number for signals for each program.
Exactly. So when I applied for internal family medicine, there's internal, you'd be given 15 signals, 3 gold, 12 silver. And for family medicine, there's 5 signals. So I had in total 20 signals, but only 15 that can be used for internal medicine, only 5 that can be used for family medicine. Yeah.
Okay. Checking for questions. Yeah, there Fatima is asking like what specialty that if you want to do a rotation in a specialty, which specialty has more hands-on experience? Is it emergency, internal, or family medicine?
Yeah, I think I could speak on that. So I did rotations in all 3, and I would say EM is definitely more hands-on because it's so procedure heavy. As a med student, they let us do suturing, unsupervised. We were able to do like intubation, central lines, art lines, but those were all supervised. So they give you the kit, they walk you through it, and once you do one, they really expect you the rest of them to be able to do it without them giving you too much guidance. They'll obviously be standing next to you, but yeah, with EM, you do a lot. And even when traumas come in, they expect you, to be putting on the EKG leads, to take the blood pressure. Like it's more of like an expectation at that point. And then I would say compared to like the other specialties.
Yeah. I think someone also asked, but I believe it's different for everyone, about the step 1, like how much time does it need, and like the general process of studying for step 1.
I took it a long time ago. This has been 3 years. But it was pass fail. And I myself I worked on the U World. I did some Words and Beyond videos, and I took assessments. I was good in the assessments, and I went to the exam and I passed. So it was but it took a lot of time because I was resident back then. So probably my experience is not typical.
Yeah, I think Facebook groups and like on Telegram and others, like they're very helpful, and you can like read other experiences, and you don't have to stick to what other people did. Like you will do your own thing, but you can like take ideas on how to. And of course, the assessments are a very important thing, and I think you should like start early on with the NBME's assessments. Don't wait. So you can like have an idea on when do you want to apply your take your step 1. And I think I'll talk from personal experience. Some are asking about like observerships as students and the visitor visa. It is hard to get, but it's better to try to get it while you're a student, because that way you have some, like for B1 visa, they want to know that you're going back, that you're not gonna like stay there in the US. And being a student is of course enough that you want to go back to graduate, and you're like you had 5 years or 4 years and you want to go graduate. So you can still try that, even if it's difficult. Some people do get the B visa, and I think some people also get hands-on rotations more if they're students than graduates. It's harder for graduates. So can anyone tell us more about like what programs or agencies do the observerships? Like if someone wants to connect and apply to these, like some names, or I think
Yeah,
Dr. Adham, yeah.
I can type in the agencies that are here in New York. There are some that have a reputation for bringing IMGs into the country, so they're not. The embassies wouldn't look at them in a very pleasant way, I think. But then there's different ones in different states. I can type the ones that I know here, and yeah, they easily to look up on Google, whatever state you're interested in, and they are so heavy on ads, so you would find them in no time.
Yeah. I think I heard even some students getting like connecting with physicians on LinkedIn. Like you can search the hospital you want to go to, or like the specialty, like if it's internal medicine or like renal, GI, and try to find like professors that aren't American. Like you can try all professors or all like doctors, but you will have a better chance if they're like Arab or like similar to our situation.
In all fairness, it kind of varies. I'm not sure what the answer, but sometimes you'd find it quite interesting how like don't try to be kind of closed-minded about reaching out. Reach as much as you can, and story is story, human experience is human experience. It doesn't matter if they are from Southern Missouri or somebody who's an Arab in Michigan from your same hometown and state. Yes, definitely you have higher chances of connecting with somebody from your hometown who's an Arab, but at the same time, once you're telling your background and you're trying to give as much relatable details as possible, you can get help from places you wouldn't think you'd be getting help from. So don't hesitate reaching out to anyone. That's what I would advise.
Yeah. I think someone's asking, is it possible to match like from Syria without a US rotation?
Very tough, extremely tough. And if it happens, it's not the rule, it's the exception. And a lot of people tried that. Very tough, very tough. You gotta come to the US. In my opinion, in order to match in the US, you gotta come here for a rotation, for research, for whatever reason. You gotta come to build connections, to get letters, to know the culture.
Someone's asking, would it hurt to do rotation only outpatient? I think like clinics or
Whatever is good, whatever you can get, do it. Outpatient, inpatient is better. In a program is even better. But whatever you can do, if all you can do is outpatient with some doctor at their clinic, do it. Whatever you can get. But some people ask about letters from their home country. So from Syria, for example, I did residency back there, and I got a letter from the program director. That would be helpful. Yes, if it's from someone who is in the lead of your program, you were a medical student or a trainee, a resident at a program, and you get a letter from your boss, that would be good because it would be about you being residents and how you were there, how you performed while you were in your residency. Yes, so get it. Make sure to get it.
okay, so even from your home country, letters of recommendation are helpful.
Yes, I would say yes, get it. If it's from a program director or from someone that is high ranked, the dean of the school, whatever, but not like from, in fact, a random doctor. No, get it
Yeah.
from someone who is in a high position.
And this is to get a rotation or a research position.
No. This is you can use it in your application.
Okay.
Yes, you can use it in your application. It's gonna look good. You were a resident, you did residency there, or you were a medical student there, and you got a letter. My recommendation for MGs would be everyone you work with, ask them for a letter. Doesn't hurt. Ask them for a letter. Leave a good impression.
Yeah. Muhammad Rami is asking, I'm sorry, you can
Go ahead, sorry.
It's okay. Is it helpful to reach out to program directors before the interview season, or is it like annoying, or
I'd
you
like
can't
I
do
would
that?
like to answer this one. Please do. Please. Well, the way you approach on the match process, I believe, is just you have to think of it. It's an actual matching process. You're finding the thing that suits you, and they are finding this thing that is suiting them. So throughout the entire preparation and the match process, always hope that these programs you're interviewing with get their ideal applicant and you finding your ideal place to go to. So if there's something that you're really interested in or place you really think that you're a good fit there, a community you're very keen to serve, reach out, reach out. Don't overthink it. If you had the chance to walk to the program director themselves, don't hesitate because they are looking for the candidate, ideal candidate too. So you're just putting yourself out there to make their job easier, to find you, to be able to see you between all this pile of applicants that are receiving every single day through the match process. So do go there, please.
Yeah, I would have thought also that you can't do that, but you have to show them that you're interested. You have to like, even that you're taking the effort to like reach out and email them. Amir Al-Shattar is asking, what's advice you will give to someone who is an IMG studying for step 1, wants to be a cardiologist and is now in the US and has been like for 6 months?
Don't leave the 6 months empty, my friend. Don't leave them. Don't do something, volunteering, do something with doctors. If you want to go into cardiology, now it's a bit early, but try to do something, some research in cardiology. Make sure to get your steps as soon as possible, get a good score for step 2. But I always prefer to not leave a big gap in my resume. It's not going to look good. When you apply to residency and then after residency, when you apply to a job, you have to, when you to get your license, you have to fill up all the gaps. It's not gonna be good in your resume for 1 year, 2 year gap. 6 months is okay, but more than that, I personally would not recommend. So volunteering with a clinic, research, get involved in something, even if it's remote thing.
Yeah. And about also the gap, someone's asking how much does the year of graduation factor in getting a residency spot? Like if it's like 2 years, if they can get after 2 years, is it a red flag for matching?
Adham, you want to answer the question? I can go ahead.
I'm not, is it Yaman's question? Because I'm trying to answer him right now.
It's Bana. Bana Ras.
Yeah, so
I did not hear the question. Go ahead, Rasheed.
Yeah, it differs. It differs between programs. Some programs has a cutoff of 3 years, some 5 years, but you will get filtered if you are an old graduate. In most cases, in most programs, they have filters for step score for the year of graduation. If you're a graduate 5 year plus, you're going to be filtered from most programs, unfortunately, and they are going to look at your application if you have a connection. But it's not, if you are an old graduate, that doesn't mean that you will not apply, but you have to put some extra effort in your connections just to make the program director look at your application, because most likely you're gonna get filtered, unfortunately. The sooner after graduation, the better.
Yeah.
Yeah.
Dima's asking, are telerotations counted as US like a clinical experience? If they can't get a visa, like do they just do anything they can, or?
Now, in my opinion, I don't know if Adham agrees, but in my opinion, if you only can do telerotations, do it. Better than nothing. Now, applying itself, will I apply or not? It's financially costly. If you can afford it, try your chances, but make sure you have a good resume. Make sure you're applying with something that makes you stand out, right? You have a good letter of recommendations, good PS, whatever you can do to enhance your chances. But I don't know. I think it's not gonna look good if you apply and do not match, because also some programs have a filter of unmatched people, because the program directors, they think I do not want to look at a resume of someone who did not match because it's already been looked at and they did not match. So it's a waste of their opinion. That's not the right thing, but they think like that. So I guess that's a questionable thing. I would not recommend applying without coming to the US. That's my rule.
Yeah.
I would totally agree with Dr. Rashid. And if there's anything I would like to add, because I feel there's the next 4 years, there's a lot of applicants who've done the steps who were very eager to come to the States, but with the stuff with the visa, it's getting very difficult. And if you're questioning what should I do this season, if you can do the telerotation, yeah, it's better than not doing anything. And if you really want to apply and take the risk, try to apply very conservatively, like only apply for the places that you know there's people there that's going to root for you, whether PGY3s or program director or attending in the hospital. Because I've heard some stories where people have not touched any state here and they spend the entire time whether in Egypt, whether in Sudan, and they applied like for 15 programs, but they only applied for the places that had great chances that, and it worked. It's very risky. It's not the typical way that we IMGs would match with, but if that is the only option, go ahead and do it. And I hope that we can stuff would change, and it wouldn't stay as it is right now. But if that is the only thing we have to do, be it. That's what I think. Thank you.
Muhammad Rami is asking if they can get a research position, but it's different than the specialty they want to match into. Is that a red flag?
Definitely not a red flag. Why would it be a red flag? No, it's not. I think get it, even though it's not in your specialty. Get it regardless, especially if you're applying to IM or neurology or psychiatry, those not very competitive specialties, better to have it in your resume. It's not a red flag, no.
Yeah.
When a red flag means that they're gonna skip your application. I don't think they're gonna skip your application just because you have a research in internal medicine and you're applying neurology. They would not do that, no.
Okay. Does anyone have anything they want to add, or anyone wants to ask any question before we end the meeting?
Did we cover all questions in the chat?
I'm trying to. You can like resend your question because I'm getting lost a little. He's asking if I apply to pathology in Syria but do internal medicine in the US. Does that? I don't think that.
No, I had half a year of anesthesia residency, so I kind of justified it in a way. It all can be fixed within the interview. You don't need to worry about that.
Yeah.
Yeah, but be prepared to answer some of those tricky questions during the interview, like why did you change from pathology to neuromedicine? And I want to just say a quick thing that during your interview, when they ask you what you want to do in the future, don't give a strict very closed answer. Just stay open. Like for example, I want to do a neuroimmunology fellowship, but I'm open to other specialties as I'm doing my residency and explore other fields. So stay open. And if you want to stay in Michigan, if you're firm about it, just say it. If you do not want to waste your chances, don't say that I want to practice in Detroit only. No, I'm open to explore other things. That would be good.
They're asking if they want to go into a more competitive specialty, is doing research a must before? I think so too, yeah. Like I think surgery or
100%, 100%. I think for orthopedic surgery, I think the average number of publications of applicants is 30. So I don't think you're gonna have a good chance if you have like 2 publications in applying. No, you gotta know what specialty you're applying to, what's the average of scores, publications, whatever, and then go for and then try to achieve this.
And do publications have to be like US publications?
What do you mean US? Like published in US journals? No, I don't think so.
Like, or like work like done with US doctors or students? Or it doesn't matter, any like you have to just have publications.
It differs from one university to another. For example, University in Michigan, there's a condition that you, as an IMG, you have to have done at least 6 months of research in the United States or North America, in Canada or the United States. Other programs, they do not have this. So it highly differs, but it's better for the research to be done with American doctors here in the US and some of the universities here. If you're talking about a postdoc research fellowship, but still, if you can do it, American University of Beirut, Turkey, whatever, just do it.
I think we covered all the questions. If anyone has to add like last minute question before we wrap up, or if any of our speakers want to add any advice.
I think we need to thank you so much, Duha and Mahmoud, for all the work that went in the background to make this happen.
Thank you.
Right,
No, you're welcome. If we can take this question, is asking if I applied to the match and got rejected, does that affect my application in the next year?
If you did not match on 1 year, some programs, not all. That's from a program director who told me that some program directors, they have a filter on unmatched applicants, but it's the minority. You're going to be filtered from some programs, but you're going to still have a good chance, especially if you can mention that in your PS with a good justification or what this experience taught you. You prepare during your interviews the answer as to why you think it don't match if this ever comes up. But you would still, a lot of people, IMG specifically, they do not match from their first time, second time, third time. I know someone from their 7th time, and they're a SAMS doctor. So, no, it's totally possible.
Yeah. Thank you so much, everyone. This was very informative. I benefited so much from all the questions, all the information you had to share. And I hope you all do good in your residencies. And thank you so much. It was very good.
Thank you all.